This is a CBS 4 News special report.
Good afternoon. I'm Ruta Shabazi. We have another coronavirus pandemic update from Tallahassee. Governor Ron DeSantis has the latest information. Let's listen in.
And supporting our hospital workers and hospital system, particularly with respect to seniors. We focused very critically on nursing homes and long-term care facilities. Early in March, I directed Jared Moskowitz to implement strict screening measures at all long-term care facilities. We had a few dozen cases in Florida, in the entire state at the time. And at a minimum, all these facilities have had to adhere to very strict screening requirements. That includes any persons showing or presenting signs or symptoms of a respiratory infection, including cough, fever, shortness of breath. It was prohibited from entering a facility. Any person who may have been in close contact with anyone infected with COVID-19 was prohibited from entering the facility. Any person who traveled internationally prohibited from entering a facility until 14 days after their return to the United States. Any person who traveled on a cruise ship prohibited from entering a facility until 14 days after their return to the United States. Anybody who has been in a community with confirmed community spread of COVID-19 is prohibited from entering a facility within 14 days of their presence in the community with community spread. And any person who resides in a community with confirmed community spread, as identified by the CDC, is prohibited. So that was from the very beginning, because we understood that COVID-19 presented significant risks to people who were elderly and with people who had underlying conditions. Right after that, I directed Director Moskowitz to prohibit visitation from all facilities. We couldn't be sure who was going in. It was a tough thing to do because a lot of the residents like to have visitors, but we felt it was the right thing to do for safety. We had about 125 cases at the time. We were one of the first states to do it, enacted earlier than many of the other states, such as New York and California, in terms of their caseload. And so basically you were in a situation where you had the staff that would have access and workers, and then obviously the residents. Throughout the whole time period, we messaged and advised all seniors, regardless of whether they're in a long-term care facility or not, anyone who was 65 and plus or with underlying health conditions, to stay home as much as possible and to avoid crowds. We also did a formal public health advisory to that effect in March, because ultimately, if you look at the way this affects different groups, there's a disproportionate impact on that community. So we wanted to do all we could do to make them safe. But beyond screening and suspending visitation, our approach to protecting seniors and residents in long-term care facilities falls into three main areas. First, we continue to conduct long-term care facility assessments. So the Florida Department of Health has developed 120 ambulance assessment teams to deploy preemptive measures to prevent the introduction of COVID-19 in the state's long-term care facilities. These teams completed assessments at almost 4,000 long-term care facilities to determine immediate unmet needs and to promote appropriate infection control practices. These assessment teams worked in conjunction with county health departments to address needs and identify facilities where opportunities for improvement existed. The Agency for Healthcare Administration is also in constant contact with facilities throughout the state to make sure we understand and can respond to their needs. AHCA staff has made over 1,000 in-person visits and made over 5,000 phone calls to these facilities. Second, the Department of Health immediately sends rapid emergency support teams to facilities who have residents that have tested positive for COVID-19. The department's rapid emergency support teams, or REST teams, operate as the incident command structure for Florida's long-term care facility response. These teams ensure the residents of the long-term care facility are in a safe and secure environment to prevent the further spread of COVID-19. REST teams remain on scene to provide support while staff members are appropriately trained to provide clinical care for COVID-19 patients. This model has been identified by the Center for Disease Control as a best practice for other states to follow. The department's best REST strike team includes an infection preventionist, local county health department staff, regional staff from the Agency for Healthcare Administration, nursing staff, a Florida Infectious Disease Transportation Network team, and an advanced life support ambulance. These REST teams have responded to 93 long-term care facilities with COVID-19 positive patients. The third component is testing. While we have been early and aggressive by implementing screening protocols and prohibiting visitation, testing remains an effective tool to identify an outbreak early and to mitigate any spreading of the virus. I've previously directed the Department of Health to conduct sentinel surveillance in long-term care facilities where residents and staff of the facilities are voluntarily tested for COVID-19, even if they do not have any symptoms. To accomplish this directive, the Department of Health successfully trained 30 paramedics to perform specimen collection and used 12 advanced life support ambulances to randomly collect samples from long-term care facilities throughout the state. But today, we are raising the bar even further. I am directing the Florida National Guard to create more strike teams to significantly ramp up testing in long-term care facilities. They have already visited and tested, I believe, hundreds of residents in South Florida with the National Guard strike teams. We are going to expand that to have 10 teams of 4, and we'll probably expand it beyond there as long as we have enough equipment and PPE, and they will begin their mission in the counties that are being most affected by COVID-19, so primarily in Southeast Florida. They'll be taking samples from all willing individuals in each facility, both staff and residents. It's critical to identify people who test positive as early as possible, and this will help us do that. One of the things that we've learned is you can have someone come in the staff, you can do a temperature check, you can check for symptoms, but people do carry this virus without a fever, without being symptomatic. And so you need to have a strike team going in and aggressively testing to try to preempt that. And what we found in a lot of these long-term facilities is the spread is more significant amongst the staff. But it's not that they weren't following the protocols in some cases, they were, it's just somebody didn't show symptoms. And so doing strike teams, I think, will be good for the residents, but I also think it'll be good to identify this with staff so that the appropriate staff can be isolated and we could prevent an outbreak among staff at nursing home and long-term care facilities. So this is an important additional protection, an additional step, and I want to thank the Florida National Guard for responding very quickly when we asked them to do it. Further thing on testing, we've helped set up and run the state of Florida, the Florida National Guard, a number of drive-through testing sites throughout the state. One of the ones we did very early on was in conjunction with Memorial Healthcare in Broward County. So far, this has been in operation for between 3 and 4 weeks, I think, and they've conducted over 11,000 tests just in that one place. They actually having people from the National Guard throughout the country come by, look at the site, try to figure out what they're doing right, and it's really become a model for people nationwide. In fact, they had a 4-star general, Joseph Lengel, recently visited the site and said it was one of the most successful sites in the country. And I think that they've gotten their wait time down to, I believe, under 30 minutes. I think I think under 30 minutes. And so they've really running an efficient operation, and that's been a big help to the people of Broward County. So we really appreciate everyone who's doing that. Of course, we have other sites throughout the state, and the National Guard has been tremendous in all their support. So some updates on kind of where we are as a state in terms of the state of Florida. You look at the case rates per 1,000 population. We're looks like we're a little bit behind Texas and California. Now, of course, we have tested more per capita than both Texas and California, but that just gives you a sense of where we are vis-a-vis the rest of the country on positive test results, positive cases of COVID-19 in the state of Florida. The death rates in the state of Florida per 100,000 in population, again, you have Texas, California, Florida, then you have some of the other states that are fighting, pretty significant outbreaks. Obviously, New York, you see very, very significant death rates per 100,000. Here's the cases for the last 30 days. So if you go back in the middle of March, obviously you were seeing a trickle of cases. Now, part of that was there wasn't as widespread testing. As we get into the 3rd or 4th week of March, the testing starts to ramp up. And so really, I would say from maybe that last week of March on, that's a pretty good baseline to look at. So you see kind of the trend. I think the 2nd of April was the highest, and then it's kind of been in a little bit of a plateau since then. So obviously, obviously, we're going to watch that every day. The number of tests that are conducted have been a good clip. When these tests are done, obviously we have our health labs that do some. Most of the tests are being done by private labs. Sometimes those negative results come in, late. We wish we could get them turned around quicker. So some of this, may be a lag from when they actually tested. All right, let's see. There. Can we go to the next one? Oh. Testing, okay. So you see how the testing is ramped up at the beginning of the month. They were harder to come by. We were sending them to Atlanta, CDC. They eventually had state labs certified to do it, so we were doing it in 3 state labs, but in a state of 21.5 million people, just have 3 labs that can run through 100 or 200 test results a day was totally inadequate. So hospitals ramped up their labs, the private labs, and we've had contracts with them. They've done a lot. So you've seen how the testing has really increased a lot, particularly over the last 3 weeks. Sometimes the up and down a little bit is more just about when you're getting results, I think, to see, you go down, then back up, then down, then back up. The trend has been more testing, and we want to continue to do that. You look at the deaths by age in the state of Florida. Obviously, most of the fatalities are 65 and plus. We do not have any under 25. It doesn't mean it can't happen. I know people like to try to twist things. Of course, it can happen. But clearly, there's a higher risk for people as they get into older age groups. And then here's the death rate per 100,000 by age. So obviously, once you start getting into that 75, 85, becomes a much different situation than people in the younger age groups. So final update on just the hospitalizations. I think if you look throughout the state, it's been pretty flat over the last 7 days. In the last 8 hours, there's been a net reduction of 27 people hospitalized in the state of Florida. If you look at the hospitalizations, Broward, Miami-Dade, and Palm Beach, they represent about 30% of the state's population. They account for almost 65% of the hospitalizations statewide. If you look at places like Hillsborough, 59 people hospitalized, Orange 95, and Duval 61. Those have been flat or even declining, which is a good sign. And then Southeast Florida obviously has more. And one thing with the testing too, if you look at the tests per person in Florida, that is obviously important. But what I did is I actually looked at tests per person in Southeast Florida because that's where the biggest outbreak is. So you got about 6.5 million people in those 3 South Florida counties, Palm Beach, Broward, Miami-Dade. And if you look at the number of tests we've done, it ends up being about 1 test for every 85 residents of those 3 southeastern Florida counties. So that's a really strong ratio. I always reference South Korea was viewed as the gold standard of testing because they tested 1 in every 200 South Koreans. Well, here in Southeast Florida, that ratio has been strong. Part of that is because our efforts with Memorial Healthcare, some of the other drive-in sites. We have 2 drive-in sites we're supporting in Palm Beach County. We have the Memorial site in Broward, and then we're supporting at least two, actually more than 2 in Miami-Dade County. We've provided some supplies for some other sites as well. So the testing has been aggressive in Southeast Florida, and we're obviously going to continue to do that. In terms of available bed space statewide, we're looking at 42.5% of the licensed beds are available right now. I think I've cited at the beginning of March, a lot of the vacancies were about 12% statewide. Most of the beds were 85, 90, 91% filled in various markets throughout the state of Florida. So when you're talking about flattening the curve, the number one reason to do that was to make sure you had enough hospital capacity to be able to handle patients who would get infected and would need hospitalization. So we worked very hard to make sure that our hospital system would hold up over this period. Right now, the hospitalizations are basically basically flat. That's a good sign, but we look at it 1 hour at a time, 1 day at a time, and just keep trying to do the right thing. So I want to thank the folks we have here with us today. We're going to have Secretary Mayhew, Jared Moskowitz, and we're going to have Surgeon General and Secretary Mayhew. They're all going to just make a couple comments, give an update on where we're at, and then we'll be happy to take some questions. So why don't we start with the Surgeon General, go to Jared, and then go to Mary.
All right, thank you, Governor. First, our thoughts with all the families and individuals who have COVID-19, especially those who have lost loved ones to this virus. As the Governor mentioned, we've had a 5-point plan in the fight against COVID-19. First, social distancing. How do we reduce our risk for getting this virus? Testing expansion and contact tracing. This is a way we can stop person-to-person transmission. How are we protecting the elderly and the vulnerable members of our society? As we've heard, this virus is particularly harsh on the elderly. Preparing hospitals for the surge and protecting our healthcare workers. And also, how do we stop the introduction of this virus into our state? And also, most importantly, the introduction of this into nursing homes and other facilities. Where are we? As the Governor mentioned, we are essentially at a plateau with a slight increase in number of cases over the past week. The percent positive individuals testing positive for COVID-19 really for the past 10 days has been remained stable at about 11%. As the Governor mentioned, the number of individuals in the hospitals have remained stable over the past week with about 2,000 hospitalizations per day. And same for individuals in the intensive care units. We've been stable at about 800 individuals over the course of the state, 650 individuals on ventilators in intensive care units. This virus, again, is particularly harsh on the elderly. The elderly account for about 30% of hospitalizations, but about 60% of deaths. We are continuing to follow the trends very carefully. As always, we are preparing for the worst, but hoping for the best. We need to continue to focus on the measures which can protect us all against COVID-19. Again, wish to emphasize the importance of avoiding crowds. 6-foot spacing. If we are going to be in gatherings, should be less than 10 individuals. We should all consider wearing a mask in public in the event that some of us are asymptomatic spreaders. Certainly do not work when we are sick. And again, for the elderly, these individuals need to avoid going out in public and certainly avoid contact with individuals who are ill. We are at a plateau situation, but cannot emphasize enough that we cannot let our guard down at this present time. Until we get a vaccine, which is a while off, this is going to be our new normal, and we need to adapt and protect ourselves. Thank you.
Great. Director Moskowitz.
Governor, thank you. So this disaster obviously has been unique, and in fact, it's the first time in U.S. history that all 50 states are under a disaster declaration simultaneously at the same time. And so obviously we're not just competing against the 50 states, we're competing against every country but Antarctica for that life-saving PPE. Thankfully, we've been able to turn the corner in a lot of ways. So to date, the division has sent out 6 million masks, 5 million gloves, 564,000 shoe covers, 515,000 face shields, 286,000 gowns, 77,000 containers of hand sanitizer, 47,000 goggles, and 22,000 Tyvek suits. And so we have millions of pieces of PPE on order that is now starting to come in, and we're going to continue to ramp up that operation all through the remainder of April, continuing into May, because PPE is going to continue to be that thing that we talk about for months to come. The division is still moving forward under the governor's direction to make sure that we have all those temporary facilities that we were working on, even though it looks like bed capacity, ventilator capacity, ICU capacity has trended in a much better direction for the state. We are still moving forward to have those facilities open. The convention center on the 20th of April, and the field hospitals in both Dade County and Broward County are already open. And so obviously we have those staffed at a minimal capacity, but have contracts in place that if we had to increase staffing, we could do that. We'll be looking more at surging staff into hospitals under their current surge plans. We're already working with a couple of hospitals now where we've given them some additional staff to meet their current load. We continue to follow the models that are out there. Here in Florida, we're very used to watching modeling, similar to a hurricane track that changes. The IHME model has changed on Florida 3 times already. First, our peak was May 4th, then it was going to be the 21st of April, now it's the 26th of April. And so we continue to watch that model as new data is gathered, and we'll continue to prepare accordingly. We are looking forward to, under the governor's direction, increasing testing in multiple areas. As we've alluded to, we're 3rd in the country at testing, and we're looking to try to do that in some more disadvantaged communities going forward. As the Surgeon General said, we're going to continue to stay the course. The 30 days to stop the spread obviously goes until April 30th, and so those mitigation measures are working. The social distance measures are working. And so the Division of Emergency Management, we just want everyone to understand that now is not the time to change our behavior. Governor, thank you.
Secretary?
Thank you, Governor. I think it is interesting as we look at the 4 individuals here, what is often not appreciated are the hundreds and hundreds of individuals that comprise these multi-agency teams that have been working tirelessly under the governor's leadership, Director Moskowitz and the Surgeon General, to support this multi-pronged effort. And I'm going to speak to a part of that, but I think it's important to continue to underscore this has all been done as a multi-agency team response, well-coordinated, well-deployed. What I am so grateful for are the thousands of caregivers and nurses and direct care staff and physicians who have been on the front lines now for many weeks, serving their patients and their residents, caring for their colleagues, and supporting their communities. Around the state, hospitals have been pulling together regionally, sharing data, working collaboratively to develop an assessment of their region's capacity to respond to the worst possible peak. As Director Moskowitz said, we've seen multiple models and scenarios, and what I have been truly impressed by and grateful for has been the role of our hospitals in truly developing an assessment of their capacity, evaluating every bed, understanding how quickly they could bring staff on, and what is the true capacity, so that what the state's response is complementary of how the region is prepared to respond and care for any surge. And we have been well served in Florida because of the emergency status system that has been in place now for several years, where hospitals have been very disciplined in submitting their data to us, so we know exactly what the occupancy is and have been able to track and trend that information. On the long-term care side, again, we've had so many calls over the many weeks supporting our skilled nursing facilities, our assisted living facilities, our intermediate care facilities, with both the directives to shut down to visitors, the guidance. I think we have said this from the beginning. Not only have we had, and the governor has had, laser beam focus on protecting our elderly, but we have acknowledged the high level of infection prevention that has been called for, that is often beyond the PPE supplies that these facilities traditionally have. And so the state has worked collaboratively with these facilities, with the associations, to get those facilities prioritized for masks, for gowns, to support them. And then we have worked with our skilled nursing facilities, our assisted living facilities, on all the guidance to support their staff. But again, let's put a human face on this. We're talking about frail, elderly individuals or individuals with intellectual and developmental disabilities whose lives have been disrupted by this, who have been cut off from family and friends. And our facilities have bent over backwards to support creative ways to support that connection. I've seen photos of staff doing line dances down the hall, 6 feet apart, to keep their staff's spirit, their resident spirits uplifted. So we have worked to support not only the clinical guidance, the adherence to infection prevention control, but to support the well-being and the mental health of so many of our residents, our patients, and the staff. As the governor mentioned, we have had well over 1,000 visits just from the Agency for Healthcare Administration, but when added to our partnership with the county health departments, EMS, we've had well over 4,000 visits. And we've had well over 5,000 calls to those facilities to talk through and work through a checklist related to infection prevention and control to make sure that we are a constant source of assistance and information. And then we have deployed teams who have been on site day and night, clinical staff supporting any facility that has needed that additional assistance. So incredibly pleased at where we are. We know that we must continue to be vigilant in our efforts to bend this curve and to support our most vulnerable populations. Thank you.
Can you just, we were talking about, I know you keep in close contact with all the folks in the various hospitals. What's their attitude now? Where was that maybe like a month ago? And I think, because I think that was instructive.
Thank you, Governor. And it is true from where we began with this and the work that the hospitals were doing. I've had the chance to speak almost daily with all the hospitals, and then more specifically to conduct regional calls with hospital executive leadership. And there is a level of confidence as they look at the data, their trends, and their preparedness. They are certainly not seeing the rate of increase, but they are confident in the level of preparedness that they have and believe that they are ready to address any surge that comes their way within the hospital. They are not seeing, or they do not have a level of concern that this is going to be well beyond the hospitals or health system's ability to manage effectively, which, by the way, Governor, is why I've also really stressed with our hospitals the importance of their regional assistance to skilled nursing facilities and assisted living facilities. It is our hospitals that have the infection prevention staff that can help to support some of the regional needs of these other smaller facilities to better manage and support those organizations.
Great. And then, Jared, can you just give an update on the latest in the supply chain? We're going to have an good announcement tomorrow about some more of the masks, which I think is exciting, and we've been working closely with the White House on that. But what, where are we on just? I mean, I know there's been a crush. Where is it loosening up, and where is it still tight?
Yeah, Governor, we've seen a change in the marketplace over the last, week and a half, 2 weeks, with your leadership, talking about some of the problems, getting those out there in the open, obviously, the White House weighing in and fixing a lot of that. And so we've seen a lot of stuff readily available. So gloves, shoe covers, face shields, which is a one-off. So that's not something that has a daily burn rate. So you give out a face shield, that person, has the face shield. Gowns seem to be a significantly higher burn rate. We're seeing gowns, and there's no standardized procedure. So some hospitals are throwing away gowns after one wear or after one day. And so burn rates are different depending upon whatever protocols that hospital feels comfortable with. The same thing with goggles. We give out a goggle. It's something that can be cleaned. It's not something that has a daily burn rate. So we're doing much better than we were a couple of weeks ago when we kind of told everybody what was going on in the vendor marketplace. So vendors Floridans are delivering. We're getting regular deliveries now. Millions of this stuff is coming in on a weekly basis, and it's going out as fast as it can come in. N95 masks, we're even starting to see some change in that area, a little slower than some of these other categories. But we're using those to focus for our folks on the front lines, and using that, using the N95 mask where it's needed. People are surrounded by other people with COVID-19.
Great. Mike?
Governor, this may be for you or Dr. Ridke, and it comes from my client in Jacksonville, but they're concerned that you're not releasing a county-by-county data on how many deaths are occurring in long-term care facilities, and it seems that you are naming some facilities but not others. What can you tell us about it?
Well, I'll let the Surgeon General opine on that. I mean, I would just say generally, Florida's data and website, there's more data put out daily basis by Florida's Department of Health than anywhere. People have commented to me across the country how good it is. So I appreciate what they're doing, and I'll let the Surgeon General address that specific question.
Yeah, thanks for your question. So within our Department of Health website, we have lots of information about county by county level in terms of zip code, and that includes the roll-up of the total individuals within that county who have lost their lives to COVID-19.
But there's no information. All that's focused on keeping elderly safe, why not be more specific about specific facilities, at least within a county?
So again, first, within each facility, there are infection control measures which we have in place. We have teams which are going in there, working with the hospitals, making sure they're doing all the proper procedures, making sure that we can support them the best we can. And so like any other individual in the community that loses their life to COVID-19, these are included in the roll-ups at the county level.
Well, what can't you say, however, which facilities have positive cases? Family members will be allowed to know that?
Family members are. So again, so if an individual has COVID-19 in a nursing home or a facility, we have contact tracing which is in place to make sure that the other individuals who've been in contact with that person are identified, and if they need to isolate, they're doing that. Same with staff members. So this is a situation where individuals are notified in terms of other family members if there's an individual with COVID-19 in that facility.
There still seems to be some confusion as to how you're determining which deaths you count in your count. I'm wondering if you can explain how you count deaths and whether or not they've already outside.
All right, you've been listening to Governor Ron DeSantis live from Tallahassee with the latest information on COVID-19. He mentioned strike teams with the National Guard will be ramped up for testing in long-term care facilities. They'll be taking samples from staff and residents even who are not showing symptoms, and they had a lot more information. We will have much more information for you coming up at 5 o'clock.